people are learning about germs. They're learning about the connection. They're learning to make the connection between invisible things they can't see and illness. So, and then also basically we want to teach them about prevention. So what can they do to prevent the majority of infectious diseases? That is one thing, that is the most important thing we can do, and that's wash our hands. So, and of course, you know, the level that we're really trying to communicate this message at, because we're really targeting young children, their parents, and their caregivers, has to be very basic, because, you know, their level of understanding of germs, I mean, they don't even know that there are invisible things you can't see that cause them to have a tummy ache, or to have a headache, or the sniffles. So we're really trying to communicate that message, both to the mostly to the children, but also to the parents, because they're key. They're the ones that are modeling the behaviors. We have a number of different cues. We've got the visual here so that they can kind of read if that's the way they like to get information. And then we have the hands-on, which is the most powerful thing, of course, for young children, but also for adults, I find. And that is, we have here a bottle of what I call pretend germs. Okay, they're not real germs, because I'm from the health department. I would never give anybody real germs. That's contrary to everything we believe in. So basically, everybody gets a nice dab of pretend germs on their hands, and then
do it on yourself so we can see how it actually works.
Okay, let's see. I wish I had a little kid's hands, because they're the best hands to do this on. But essentially, if I were to put this on a little kid's hands, I would tell them to rub and scrub, frotte, friegue, get those germs, pretend germs, all over your hands, your nails, in between your fingers, everywhere. Because in reality, there are germs, both good and bad, all around the world and on our hands. And then we have a very special light here that allows us to see these invisible, otherwise invisible germs.
I noticed some things appear to be glowing. Are the folds of our skin where germs often reside?
Yes, in fact, they love to reside in nice, warm, more moist places on our bodies. But the other thing about the folds and the nail beds is that those are the places that we don't reach as effectively when we hand wash. So they're often neglected. You know, we might get the surfaces, the fingertips, the palms of our hands, but oftentimes those little cracks and crevices are a little bit neglected. So, or we don't dry our hands very well, so the kind of the moisture, the water kind of sits in those folds. So after kids, parents alike get to see all the germs on their hands, then their task is to go wash the hands. Because of course most of them figure out that, ooh, what are we going to do to get rid of all these germs? So then the next step in this process, this learning process, is that they go wash their hands. And so we have really fun ways to engage them in washing their hands. One of my favorite partners in crime, our little silly duck, the kids gravitate towards.
Don't forget to wash your hands.
After they're done washing their hands, for, as the sign indicates, at least 15 seconds, a good rubbing and scrubbing, similar to the way that, you know, we put on the lotion, and dry it. Dry your hands really well. They come back out. They get to. This is where the rubber hits the road. We get to see how well they really wash their hands and how good they are at germ busting. They put their hands back under the light, and that will reveal any areas that they missed. People really want this information, particularly around flu season, but what I find in my work with little kids is that kids have the sniffles and the green gooky nose all year long. Summer is not, you know, a time when kids are, you know, just well and happy and never get the sniffles. And so hand washing is something that's so important, and especially from a food service standpoint and from the standpoint of food safety. Any of those food handlers who are handling food, and that includes our parents, that includes our child care providers, that includes our school personnel, anybody who's handling food. We want to make sure we're washing our hands, as our signs indicate, before eating.